Hey there, it's Eric and welcome to our video conversation. Last week we celebrated National Manufacturing Day, and as a part of that I had a chance to visit several different manufacturers here in the Twin Cities, emphasizing the opportunities that manufacturers have to continue to grow and expand. Now we're going to get to our questions though. The first actually is a tweet that I got from Linda in Corcoran. She tweets, at Representative Erik Paulson, new CMS data finds that 20% of Medicare beneficiaries in hospice care have dementia. Thank you for supporting the Palliative Care and Hospice Education Training Act. Actually, Linda, thanks for sharing your support for that initiative as well. A lot of folks may not realize it, but today, 5.4 million Americans suffer from Alzheimer's. In fact, it's estimated that every 66 seconds, someone is diagnosed with Alzheimer's, to the tune of where now 1 out of every 9 seniors age 65 and older also has Alzheimer's and dementia. It is a significant health issue and a significant cost in healthcare. The good news is I am supporting this legislation as a co-sponsor. It's called the Palliative Care and Hospice Training Act. It will ensure that we are training the next generation of healthcare providers and doctors to deal with Alzheimer's by giving them training centers for health professionals for the future, including best practices in this type of work. Next up is an email that comes in from Kevin in Brooklyn Park, and he writes in, Dear Congressman Paulson, please get our healthcare premiums back in line. Our healthcare premiums have skyrocketed. We own a small business in Brooklyn Park and insure a family of 4. We now have a plan that has a $13,000 family deductible. If you add up the premiums and the deductible, it is almost $30,000 paid out before we even benefit from our plan. It's simply unsustainable. We're debating whether to risk going without coverage and pay the penalty. Please help. Sincerely, Kevin. Actually, Kevin, it's no secret that the Affordable Care Act has become very unaffordable for too many people. It's actually made healthcare worse by the day in the country. And now we have the news that another 100,000 Minnesotans have been removed from healthcare options because they were eliminated from being able to purchase from the Blue Cross Blue Shield market here in the state of Minnesota. There is a better solution and a better answer. In fact, there's bipartisan opportunities to make headway by having more competition in the market, by making sure we've got medical liability reform, and by making sure that health insurance is portable so you can take it with you no matter what your age, from job to job, and you're not job locked based on your career to get health insurance. Bringing costs down through more value versus volume and more preventative and wellness components for medicine is also a good way to make headway on this issue. I want to thank everyone for taking the time to join with your thoughts, your questions, your ideas. Continue to reach out anytime on Facebook, on Twitter, on Instagram, or of course on the website at paulson.house.gov. Have a great weekend and a great week.